Now that you know how to work the player, click on the Start button and let's get started.
Welcome to this video about other topics of interest to cancer survivors, such as questions about dietary supplements, fasting, sleeping, mental health, stress, and marijuana. Are dietary supplements safe during and after treatment? Many cancer experts advise against taking supplements after treatment or recommend taking supplements only if they are required to treat a deficiency. If you choose to use supplements after your treatment is over, be sure to only take the recommended dose and avoid high doses of any nutrient. If you are being treated with radiation, some supplements can cause skin sensitivity and other severe reactions. If you are being treated with chemotherapy, there is a risk that some supplements might interfere with the chemotherapy treatments. Additionally, some poorly regulated supplements might cause other harm. For these reasons, it is generally recommended that you avoid supplements until your treatment is complete. However, in special cases involving chronic conditions such as osteoporosis and macular degeneration, research has shown that the benefits of appropriate supplements outweigh their potential harms. If you choose to take supplements, make sure your healthcare team is aware of what you are taking so they can advise you of any interactions with your treatment. What is intermittent fasting, and is it healthy? Intermittent fasting is a dietary pattern that consists of alternating between eating and fasting periods during the day. One pattern involves alternating eating and fasting days during the week. Another pattern involves alternating eating and fasting intervals during each day. For example, fast from 7 p.m. to 7 a.m. and eat from 7 a.m. to 7 p.m. There has been interest in intermittent fasting among some cancer survivors because the media has covered recent research studies suggesting that intermittent fasting may increase the effectiveness of chemotherapy and reduce tumor progression and toxicity. However, most of these studies have been done on cells in a lab or on animals and cannot be generalized to humans. More research is needed before any recommendations can be made for cancer survivors about intermittent fasting. What should I do if I have trouble sleeping? Almost 40% of cancer survivors have difficulty sleeping, even up to 5 years after diagnosis. Keeping a sleep diary or developing a sleep hygiene plan might help you understand and influence your sleeping patterns. A sleep hygiene plan can include sleep testing, lifestyle changes, medication changes, or sleep therapies, which can include cognitive behavioral interventions to help with relaxation and improved sleeping patterns. And remember, being physically active may help to improve sleep for cancer survivors. How can I manage my mental health? Cancer has many mental and emotional effects. These can include difficulties with coping, struggles with decisions, and feelings of isolation. These can also include difficulties with sharing emotions, grief, and fear of death and dying. Counseling, education, and support groups can help you to cope with cancer-related mental health stresses. Physical activity can also help to reduce depression and anxiety. It is important to find the right kind of support that works for you. Talk to your healthcare provider to find out more about your options. How can I manage my stress? It is important to acknowledge that anxiety and distress are normal symptoms among cancer survivors. Fortunately, there are some good strategies that can help you to manage your stress levels. For example, some helpful strategies include spending time outside, eating well, sleeping well, relaxing, journaling, and engaging in new hobbies. You can also relax more by practicing deep breathing, visualization, meditation, and yoga. Other helpful strategies and therapies include acceptance and commitment therapy, cognitive behavioral therapy, storytelling, exercising, and telehealth consultations. Finally, interventions can combine both medical and psychological methods. Psychoeducation methods educate you about the mental and emotional aspects of stress in your life and what you can do about it. Guided imagery sessions help you to relax by creating and sending positive, healing mental messages to your mind and body. Both methods can help you to understand and manage your stress so that you can improve the quality of your life. Can I use marijuana to help manage my symptoms and side effects? The U.S. Food and Drug Administration has approved 2 drugs based on marijuana compounds, dronabinol and nabilone, both of which can be used to treat nausea and vomiting from chemotherapy. It is not recommended to delay conventional medical treatment to rely on marijuana alone, as there is currently no evidence that cannabinoids can cure cancer in humans. Deciding whether to use marijuana should be a joint decision between you and your healthcare provider, and your decision should consider the benefits, harms, your personal preferences, and any laws or regulations that may apply. Resources. The first resource on the left is the American Cancer Society Cancer Survivors Network website. This site is a peer support community for cancer patients, survivors, caregivers, families, and friends. The second resource on the right is the American Cancer Society resource for post-traumatic growth and cancer. Thank you for watching this video on topics of interest to cancer survivors. For more information on the benefits of healthy behaviors for cancer survivors, please see the other videos in the collection.